Good afternoon and welcome to today's public hearing. This hearing will include Columbus City Council's Health and Human Services and Workforce Development Committees. I'm Councilmember Priscilla Tyson, President Pro Tem of Columbus City Council and Chair of these committees. I would like to recognize Councilmember Stenziano, who has joined me for this hearing this afternoon. Before we begin, please be aware that this hearing is being recorded for rebroadcast on CTV, the Columbus Government Television Channel 3. The rebroadcast schedule is available at www.columbus.gov. The subject of this afternoon's hearing is the Health and Human Services and Workforce Development budgets that are included in the 2018 operating budget. Several speakers are on the agenda this afternoon, including Executive Director of the Civil Service Commission, Amy DeLong, who will speak on a workforce development initiative. Deputy Director of Community Development for the Department of Development, Hannah Jones, who will present on the Human Services funding, and Assistant Health Commissioner Roger Clorn, who will speak about funding for the Columbus Public Health. I will start with the Workforce Development Committee. Employment is an important quality of life indicator. It is extraordinarily difficult to enjoy a high quality of life without access to reliable work that provides a decent wage. While the unemployment rate has continued to decrease, in October it was 3.8 for Franklin County, it is still difficult for many in our community to find work. In recent years, the city has focused on workforce development by investing in job training programs at social service agencies. In addition to those efforts, we have one very unique program at the city that has proven to assist individuals in obtaining meaningful employment. What further makes this program special is participants are restored citizens who are offered a chance to expand their opportunities for better employment options. To provide more information on this program, I will turn it over to Executive Director of Civil Service, Amy DeLong, to share her budget and this program. The floor is yours.
Thank you, Chair Pro Tem Tyson and Councilmember Stenziano. I'd like to share a few highlights about the program. Basically, I want to say restoration is not only a second chance for individuals who have been incarcerated, but it's really a new beginning. The program is rigorous, providing work readiness training, actual work experience, wraparound services for these individuals who participate. They also have an opportunity to do specialized training programs that result in certifications, which also increases their qualification, which is beneficial for hiring potentials. And in addition, it also helps, which is our ultimate goal, them secure full-time employment, and our goal is with benefits. The success of Restoration Academy is a result of a collaboration of many of our partners in our community, especially the Workforce Development Board of Central Ohio, who has been there with us from the beginning. This year we've had our same partners who have participated in a variety of different ways, maybe not to the potential in our past, but we're looking at revamping the program this year. So I'm hoping that we find out what role we're all going to play as we move this program forward, because I think we have a great opportunity with working with the Workforce Development Board and their CEO, Lisa Pat McDaniel, to make a big difference in, I guess, the perception of what each of these partners brings to the table. This year we've worked some with Alvis, Impact Community Action, Eckert, Columbus Urban League, Primary One, the YMCA, Franklin County Reentry Task Force Coalition, and Columbus Public Health, along with ResCare, which was our primary partner that worked with our individuals and also helped find employment opportunities. Without the partnership with these agencies, the outcomes, I think, of this program may not be as impactful. Share some of those statistics, I guess, is since 2012, 159 of our 186 participants have graduated from our program. This year, I'm proud to say, was the first year of all of the 6 years that we've actually had all of our participants, 16 of 16, graduated and were involved in the program the entire 6 months. To date, we have 46 participants who have obtained employment from the City of Columbus. This year, Mikey Federer will be working for me very excited about that. And 101 of our graduates have obtained gainful employment with over 50+ public and nonprofit companies. Our current placement rate has been about 91%, and our retention rate in these positions for 2 years has been approximately 82%. I think the statistic I value most is the recidivism rate of the restoration participants is still 0%, and we've tracked back from the very beginning of our program in 2012. But I think right now the turning point for this program is we need to grow our employer base for the program for its continued success. And we need for employers to be willing to stand up and give these individuals a second chance. One of the important statistics I mentioned last year that got a lot of notice was these individuals are an important part of our workforce. Over 1,500 people return to Franklin County from our Ohio prisons each year, and over 214,000 adults in the city of Columbus are estimated to have a criminal record. So that's why it's extremely important for each of our employers to say everyone deserves a second chance and to consider hiring those individuals with criminal records. And I want you to consider by sponsoring this program and being a part of it to give these individuals a second chance. With that being said, I'd like to turn it over to my partner in crime, no pun intended, Lisa Pat McDaniel, the CEO of the Workforce Development Board.
Thank you, Director, and welcome, Lisa, to Council Chambers, and would just love to hear your comments on this program and any other needs that are in the community in regards to workforce. Thank you.
Well, thank you so much, President Pro Tem Tyson and Council Member Stinziano. I don't think that I could add anything more to Restoration Academy than what we all experienced together last Friday when we heard the powerful testimony of 2 of the participants and saw the faces of the other 14 participants who have got another lease on life and have gotten employed. One of the really neat things about this particular year, and I would be remiss if I didn't mention that at the beginning of the program year, we had COIC still involved, and we're big players in helping this happen. The majority of those 16 people were actually placed into direct employment almost immediately, and then we continued our support of them. Last year when I was here before you, I mentioned that we really wanted to take another look at the Restoration Academy. How could we bring additional resources and try to expand it so that we can get back to the level that we had been, I think, at the beginning of the program, because when you hear the statistics that Amy mentioned, 16 out of a potential 214,000 certainly seems very small, and we need to expand that as much as we can. We will be actually having our second meeting, revamping meeting this Thursday with a core number of our partners to again talk about how we might do that, how we can make it more expanded, and where those resources could potentially come from. So I just want you to know that what I said last year, we are moving forward on and trying to look at how we can revamp that. So this is a very, very important part of what we do. One of the most rewarding is to see these people be reemployed or employed for the first time, depending on where they were when they come to us. As you know, but this is just one of the many things we're trying to do at the Workforce Board, because one of our biggest populations, in addition to those restored citizens, are the people here in the city and in the county who are working hard at several jobs. And what we need to do is get them to be skilled up so that they can have one job that pays a sustainable wage that helps them to support their family and that allows them access to benefits. And so this next year, we are spending a lot of time in that strategy as a board. So I appreciate the opportunity to be here to talk to you and hope that we'd love the support you've already given us, and we look forward to the future support. So thank you very much.
Thank you. And Director DeLong, you didn't state the amount that is in this budget for a Restoration Academy, the dollar amount.
Our grant is for $200,000, but our approximate is $286,000, and that $86,000 placed for our coordinator, Trika Cradle, who basically is the person who daily is mentoring, calling upon these people, making sure these people still believe in themselves as they're going through this process, because in many cases, they've had employment, but it ends as soon as people find out they have a background, or as soon as someone finds it on the internet that they are a restored citizen. And, you know, as rumors go around the workplace, that sometimes it's caused these individuals a little concern and ultimately worried whether they're going to get to stay. And she's the reassurance every day. She's the one that makes sure they're going out and doing the community service that we ask them to do as they are part of this program. She makes sure they get to the classes that we also offer on the wraparound services. And she provides just that networking with them. Each month they have an evening that they go to the public library, and the group gets together and talk about what their concerns are, maybe the positives that they're going through. And when they share that as a group, it helps build their strength and commitment to keep going, because sometimes these individuals don't believe there's a light at the end of the tunnel.
Thank you, Director. This is certainly an amazing program that certainly started here with Mayor Coleman, and certainly we've continued with Mayor Ginther has it in his budget through development as well as through your department, and just really do appreciate the work of all the organizations that are supporting this work. I just want to make sure that that the organizations that are involved in this program are not being paid to be partners with us. Is that correct?
That is correct.
Thank you. Just want to make a clarification in that regard. And so, again, I thank you for your leadership, and certainly we want more employers to be getting people a second chance. And if someone is interested in Restoration Academy in 2018, because it's in the budget, how would they become a part of the Restoration Academy?
Two ways. First and foremost, they can call our office. They can also, and that's civil service, and they'll be contacted with Trika Cradle. They can also go to ResCare, which is our main partner, and they can get a variety of services there until Restoration Academy starts. And I think we also have a slew of information on our webpage that can direct them to all of those resources, including the criteria that's required to be a part of that program. And one other, Ohio Means Jobs is the job center where they can go. I'm sorry.
Again, thank you for your work, for getting people, working with our restored citizens to help them improve their overall quality of life. I will now transition to Health and Human Services, and who provides funding to some of our most vulnerable residents. Our first speaker in this committee today will be Hannah Jones, who will speak to our efforts to fund social service programs that have proven outcomes and that are offering services to address the critical needs of our residents. And this includes employment initiatives, food access, emergency shelter, and much more. To provide additional information on the details of the budget for Human Services is Deputy Director Hannah Jones. The floor is yours.
Thank you. Good afternoon, President Pro Tem Tyson, Councilmember Stinziano. Today, I will be presenting the portion of our department budget that supports our social service agencies and the services they provide to Columbus residents. The overall human services budget for the Department of Development is proposed to remain at $5 million. $2,627,000 come from the general fund, and $2,373,000 come from the Emergency Human Services Fund. $4.1 million of this budget will be allocated to the 31 organizations that were originally awarded grants through our competitive grant process that we undertook in 2014. As you know, we've extended the original 3-year funding cycle for a 4th year through 2018. These 31 organizations administer 38 programs that address the needs of Columbus residents in 3 priority areas. First is safety net services, which encompass emergency and basic needs services. Second is economic success, such as programs that Amy and Lisa just talked about around employment and self-sufficiency. And third is social success, looking at what it takes to create safe and healthy individuals, relationships, and neighborhoods throughout Columbus. The competitive funding approach has allowed us to hold our agencies accountable, have more timely reporting, as well as better communication with the city, and provide agencies an opportunity to learn from both the successes and challenges they encounter as they implement their programs. I know that we have a number of organizations who will talk specifically to you about what they have done, but some examples of accomplishments from our funded agencies who are in the midterm of their funding agreements include 121,544 low-income individuals who have had access to free food via via the Mid-Ohio Food Bank produce markets, which are held throughout Columbus. 89 children who were enrolled in the YWCA Safe and Sound program for a minimum of 10 days for the first 2 quarters of the program year. During this past summer, we had 80% of the youth who participated in the Boys and Girls Club Growth to the Great Futures, who experienced no summer learning loss as measured by learning circles through their engagement. We had 132 immigrants and refugees who participated in ETSS's employability services and were able to gain employability soft skills, as well as 105 participants who obtained jobs in the first 2 quarters of the year. In the first 2 quarters, we had 9 new women-owned businesses that were created, as well as 7 new jobs through ECDI's Women's Business Center. And Huckleberry House's youth outreach program linked 166 youth to emergency shelter and connected 37 youth to at least one community resource in the first 2 quarters. Just as we did in the 2017 application and funding process, we have asked each organization to submit the following for 2018. An application that includes a budget, as well as performance outcomes for 2018, as well as lessons that they learned through 2017. These were submitted to our Human Services Coordinator, Kim Stans, in December 8th to be specific, and it is our goal to notify organizations of their conditional awards in January, pending City Council's final approval of the 2018 budget. In January of 2018, the administration will work to form a small internal working group to shape the 2019 Human Services funding allocation process. The working group has the goal of making recommendations to the mayor in March. We will then hold key stakeholder conversations to both gain feedback as well as input on the recommendations that the working group puts together, with the goal of fully communicating and finalizing a plan to move forward by April 30th of 2018. We understand that human service agencies currently receiving city investments rely on these dollars to fulfill their missions of service to our community. We also understand that extending these contracts for a year through 2018 beyond the original 3-year commitment has limited our ability to invest our finite resources in new programs who are also doing impactful work. The goal of this working group will be to find the right balance between these 2 realities while continuing to meet the needs of our new and ongoing needs of our community. And your leadership, President Pro Tem, will be critical in your work with the Human Services Committee to provide valuable input to this working group as well as moving forward with the recommendations. In addition to the competitive process, the department will continue its partnership with 3 organizations that provide important services to the City of Columbus. A renewal of our agreement with the Adam H. Board for $288,799 for their continued work with youth in the area of alcohol, drug, and substance abuse awareness and prevention. We will be renewing our contract with Hands On Central Ohio for $192,659 for their intake and referral services that they provide to the residents of Columbus through the 211 phone and resource database, as well as access through their website. And finally, a renewal of our contract with Community Research Partners for $133,784 to provide community data access and technical assistance for specific partner research projects with the City of Columbus. In addition to the $5 million that is allocated to the programs that I just described, the Department of Development will be providing $5,379,650 in general fund dollars to the Community Shelter Board and its partners for the continued work of addressing homelessness within our city. Funding includes the provision of emergency shelter and other crisis response initiatives that they manage. It also includes expansions in 2018 to provide street outreach services, assistance to homeless families in the new family shelter, and services that are specific to pregnant women and non-VA eligible veterans who are experiencing homelessness. Both of these expansions help us to continue working toward our goals for Celebrate One, as well as the goal of ending veteran homelessness in Columbus. I am happy to answer any questions that you or Councilmember Stinziano may have.
Councilman Stinziano, do you have any questions? No, I don't think I have any questions. I think I appreciate that you have shared the process that will take place moving forward. Certainly, as you just mentioned, when we first put the criteria together for human services, there were issues in the community that we certainly had not addressed at that time, and that's why I know we made it a 3-year process. And so we think about what's going on in terms of infant mortality, what's going on with the opioid epidemic. We're seeing more in looking at Celebrate One and even the relationship with the shelter board. So there's other needs that certainly that we want to begin to, we are addressing, but now we need to, there are other issues that have to be addressed. And so I'm excited that we will start the process in January looking to address these issues I just mentioned and other issues in this process. And so to the organizations that have been getting funding, they get an extra year to be able to use those dollars, because I know the need is still there for those organizations, and then for them to allow them to continue the good work. And so we know what the dollar amount is, and I don't have any questions to ask you. I think you've addressed everything, because I know we have some speakers who want to come up and share their comments in human services. And so again, and you'll have that opportunity, but we want to get through the presentations first. And so the next presenter will be Roger Clorn from the Department of Public Health, who will provide information on his budget. The floor is yours, Roger.
Good afternoon, Chair Pro Tem Tyson and Councilman Stinziano. Thank you for the opportunity to highlight Columbus Public Health's proposed 2018 Health Special Revenue Fund budget of $32,406,377. Columbus Public Health played an important role in protecting the health and improving the lives of all residents in 2017. Our community continues to be challenged by an opiate epidemic, a near-record number of gun violence deaths, one of the highest infant mortality rates in the country, and health disparities created by the social determinants of health. These critical issues will continue to impact the community and our work into 2018. In 2017, we were an active partner in the Franklin County Opiate Action Plan, continued our work with Celebrate One to address infant mortality, and started the CARE Coalition to provide community-based violence prevention services, such as training 400 community members on adverse childhood trauma and 25 community intervention team members on emotional first aid and de-escalations in the Hilltop and Linden neighborhoods. And while working together with all of you to address these pressing public health issues, we also continue to provide the basic public health services that our residents depend on to live healthier and safer lives. In 2017, these basic services included giving nearly 30,000 immunizations to protect against preventable diseases, providing STI services to nearly 7,700 patients, investigating and responding to 61 outbreaks in order to protect the public's health, conducting more than 15,000 food inspections, and nearly 97,000 birth and death certificates were issued. The proposed 2018 budget allows continued provision of public health services that are mandated, as well as priority programs that the Board of Health deems minimally essential to meet Ohio's public health standards. We also will address our community's priority areas while continuing our basic services and programs that protect health and improve lives. Columbus Public Health will have the opportunity to expand services to address two critical local health issues. First, we will establish a medication-assisted treatment, or MAT program, and related medical care at Columbus Public Health to better serve those addicted to opiates. This expansion supports the recognized best practice that the most effective intervention for those abusing opioids is combining MAT with ongoing intensive substance use therapy. Given the high number of residents abusing opioids, a MAT program at CPH will provide treatment access for individuals who have barriers getting MAT elsewhere in our community. This program will provide medication to help break the cycle of active opioid addiction for approximately 275 residents, and will provide wound care and other basic medical services to approximately 500 residents at the Safe Point Harm Reduction Clinic. This expansion will also double our capacity to link clients with Hep C to care in order to prevent and reduce the spread of infectious disease in our community. We will also expand our comprehensive maternal tobacco and smoking cessation program that addresses factors that contribute to infant deaths, including preterm births and SIDS. Women in Celebrate One neighborhoods with the highest rates of infant mortality also have the highest rates of smoking. This new program, or expanded program, will expand our Baby and Me tobacco-free program to directly provide clinical cessation services and incentives to approximately 700 pregnant and new moms. While increasing our ability to address the opiate and infant mortality issues through expanded services, we also acknowledge a reduction to Primary One Health. This reduced support to Primary One occurs as other third-party reimbursements have increased. These savings allow us to address and positively impact the mayor's priority areas without any reductions to other basic services. In closing, I want to assure you that your investment in our programming and services means quality public health protection is available to our residents. We will continue to operate with high efficiency and effectiveness to protect the health and improve the lives of all residents. We appreciate the support of Columbus City Council, and I can answer any questions either of you may have. Thank you.
Thank you, Roger. And so your overall proposed budget is $32,589,485. Is that correct?
Including CDBG, correct.
CPG, okay. And then you have a total, so total staff's 254. You have 6 additional staff, is that correct, for this year's budget?
Correct.
And 4 of those are going to be in the program that, the Medicaid-assisted program.
Medication-assisted.
Is that correct?
Correct.
Thank you. And the other 2 employees, where the addition is going to be in
the smoking cessation is technically not part of the budget. It's in some city set-aside funds, citywide funds, but the real net change is the 4 positions for the medication and treatment and the tobacco 21, which was the budget was revised in 2017, so the net change from start of 17 to 18 is why that's the increase there in tobacco 21.
Thank you. And again, I know that I think I asked this question at the hearing, and I know that I know they'll be speaking. So Primary One is here, and again, the belief is that you can share the belief in reducing their allocation by $250,000. Can you share that again with that, the reason for that?
Well, unfortunately, with limited dollars, we needed to reduce their contract in order to balance the budget. Otherwise, we would have had to reduce staff and other services within the department. Given the reimbursement environment that has occurred over the last 2 to 4 years, where third-party reimbursements are improving and the amount of the uninsured is reducing. While these are tough decisions, we believe that will have less of an impact on the public than if we had kept their contract as is and had to reduce some of our internal services.
And one of the other programs that I think I just want to highlight is that funding is in this budget for a part-time epidemiologist to study and establish a local violence-related public health data set to better understand violence, specifically gun violence in the Columbus neighborhoods.
Correct. They will be analyzing some data that we're capturing now, and hope that will guide our programming and department, as well as other responses within the city to those data points.
Thank you. All right, well, thank you for, any questions, Councilmember Stenciano? Thank you. All right. All right, well, I am going to, again, I want to thank the departments for providing us with their budget information, and now I am going to allow our speakers to come and certainly present on the proposed budget in Health and Human Services and Workforce Development. And our first speaker this evening, and you have 3 minutes to provide information to us, is the Executive Director, Michelle Heritage from the Community Shelter Board. After Michelle will be Primary One, the Executive Director, Charlita Tavares, and then Ernest Perry, who's the President and CEO of Hands On Central Ohio.
Good afternoon.
Good afternoon.
Good afternoon, President Pro Tem Tyson and Councilmember Cinziano and Michelle Heritage with Community Shelter Board. Your longstanding investment in Community Shelter Board is an investment in 16 different agencies that deliver services across the community to prevent and end homelessness every day. Your support helped fund homeless services for 12,000 people last year. Thank you. Mayor Ginther's proposed budget for 2018 is just $75,000 shy of keeping the homeless system funded at 2017 levels. This afternoon, I'm asking for your support to close that $75,000 gap to help us stay whole. Council members, thanks to your support and partnership, we're able to accomplish a lot over the last year. For example, 45% of families calling the homeless hotline were helped to find a better option than coming to shelter. 255 households on the brink of homelessness were served by prevention programs and did not become homeless. More than 1,000 families and 5,500 single men and women were kept safe in our network of emergency shelters. Over 1,800 households in shelter were rapidly rehoused and stabilized, and more than 2,000 people, all of whom are disabled, were thriving in permanent supportive housing. None of this could have happened without your support. I'm proud of the work that we and our partners are doing, especially for veterans and pregnant women. We prioritize veterans for shelter so that no veteran has to sleep on the street. Working with our partners in the VA, we stabilize veterans in housing quickly with rental assistance while getting them connected to employment, job training, medical care, and other supports. We've built out a systemic response to ensure that homelessness among veterans is prevented whenever possible, and if it does occur, it's rare, brief, and non-recurring. We're very close to meeting the federal guidelines to efficiently declare a functional end to veteran homelessness in our community. For pregnant women, we aligned with Celebrate One in an effort to reduce infant mortality by prioritizing pregnant women for shelter and housing. We expanded a successful rapid rehousing program to target homeless pregnant women with a deeper rent subsidy and case management focused on GED attainment, workforce development, and employment. But we need to do more. We need to get upstream and prevent expected mothers from becoming homeless in the first place. The governor's office is willing to invest in prevention for expectant mothers if we can secure matching funds. We want to expand prevention efforts that will help women deliver healthy babies and provide safe and stable homes. We will oversee dozens of programs in 2018 to keep people safe, help them find housing, and get back on their feet. We respectfully request your support to keep the homeless system funded at 2017 levels. Thank you for your leadership and your partnership and your deep commitment to the most vulnerable citizens in our community.
Thank you for coming down and certainly sharing your testimony. Can you just briefly share the impact of the $75,000 gap?
The $75,000 gap means that we will not be able to leverage the money from the governor's office. That means we won't be able to do that specialty program for pregnant women. It also means that we may have some problem with shaving a little bit on some other programs, most likely the rental assistance dollars, which are really important to get people out of shelter with.
Thank you. Any questions, Councilman Cinciano?
Great.
Thank you for coming down and sharing. Just I really do appreciate the work that you're doing for our vulnerable residents that happen to be homeless.
Thank you.
Thank you. Thank you.
Appreciate it.
Mm-hmm. Good afternoon. Senator Tavares.
Thank you very much. Council President Pro Tem Tyson and Council Member Stinziano, I'm Charlita Tavares. I'm the CEO of Primary One Health. It's all one word, Primary One Health. And I'm here to provide testimony, thank you very much, testimony on our request to maintain funding at 2017 levels. I'm not going to go over the history and the mission, but our overall vision is to provide quality care for all in the city of Columbus. I'm going to skip through a lot of these materials because I know that members of council know about our services. These were some of the board's strategic priorities. Those are the services that we provide. I want to go into the partnerships that we have with Columbus Public Health. We share a dental director. We provide shared space for the women, infant, and children clinics that are at our Primary One Health sites. We have a women's health program that Columbus Public Health transferred their OB program over to Primary One Health in 2016-2017, so we're seeing all of the OB patients now. We share the space that the city has graciously built. We pay over $500,000 annually for the space at 1180 East Main Street, 240 Parsons Avenue, 1905 Parsons Avenue, which is the John Maloney Building, and 2300 West Broad Street. We had contract goals that we are very proud of our numbers. To date, we're at the third quarter, so year to date. First trimester prenatal care, the goal was 60%, and we're at 61%. Prenatal appointments within 4 weeks, the goal was 95%, we're at 100%. Healthy birth weights greater than 2,500 grams, the goal was 92%. We're at 91% at this point in time. The healthy birth spacing, which is critical for infant viability, the goal was 99%, and we are at 99%. The birth control, increasing birth control by 18% over the 2015 goal, which would be 735. Year to date, we're at 530 with 3 months remaining. That was year to date of the third quarter. Postpartum care with appropriate intervals, the goal was 65%, and we're at 81%. Let's see, the next area that I wanted to go into is patient visits. I think we're at patient visits for 2017, third quarter year to date is 117,895, which is a 19% increase over 2016, which was 98,995. OBGYN visits were 20,598 to date, or as of the end of September. Dental visits were 14,750. Vision visits were 12,312. Patient visits these are unduplicated patients in 2017. At the end of September, we had 38,809 patients which was a 17% increase over the same time in 2016, which was $33,171. I want to go on to the request that Primary One Health has with the City of Columbus. We have yet to have Congress pass their appropriations bill. So they have not provided funding for community health centers. They have not, I'm going to skip through here so I can, yes. They've yet to pass the appropriations for community health centers and for the Children's Health Insurance Program, which impacts Primary One Health and all of the health centers and health providers in Franklin County. The impact of Primary One Health means 70% of our federal dollars would be eliminated. As of September 30th, we have not had any fix to the funding cliff. That would be a loss to Primary One Health of $4,348,138. That would mean 5,300 patients would lose access to care, and it would probably be the loss of one site out of the 10 that we have in Franklin County. And it would be a reduction of up to 50 staff members. Our request to the City of Columbus and to Columbus City Council is to maintain funding at the 2017 level in order to maintain services. The $250,000 cut will result in the reduction of services for dental and OBGYN programs, specifically at St. Stephen's. We got a grant from the federal government to expand operatories at the St. Stephen's location to go from 9 operatories to 15, which our goal was to expand women's health and prenatal care. That would have to be eliminated. We would also see larger numbers. As a federally qualified health center, we see the largest numbers of uninsured immigrant and refugee patients. We have increased the number of pregnant women and their visits, and we would be reducing our shared efforts to reduce infant mortality. So that's why we believe the $250,000 is critical to maintain the services as we've grown those services over the last year. I am happy to respond to any questions, and I will leave some brochures with Columbus City Council.
I'm going to say, I'm President Tavares, so at least Senator Tavares, but certainly thinking about the impending funding cliff, and as you just mentioned, if that does not get resolved, that there is a $4 million loss in terms of federal funding to your organization, but any of the other federally qualified health centers would also be subject to that too. And that means the patients that, again, come to you for care, our community will be significantly impacted by not having, one, you getting the federal funding, and certainly, it is certainly a major concern for this community. The question I have is that for the $250,000 that you mentioned would result in reduction in services for the dental care, which we know that the importance of dental, as well as the OBGYN programs. And those are the programs that the Columbus Public Health asked you to take on OBGYN programs. Okay. And I think that, and maybe you can quickly share this, is that talk about I think there's the thought of, because we have had, which we know is now in peril, but the Affordable Care Act, that, and with Medicaid expansion, that you are receiving more dollars, and so there may be that the city does not necessarily have to, provide more dollars because you're receiving more dollars from other programs. Can you share that, please?
Absolutely. Thank you for the question. Madam Chair. The expansion of Medicaid was very important in the city of Columbus and the state of Ohio. The expansion provided insurance for more of our uninsured that we were seeing at Primary One Health. So that has been certainly a blessing to our community and to our state and nation as a whole. The numbers of uninsured have not gone down significantly. We still have open enrollment that is taking place from now until Friday the 15th. We are seeing significant numbers of people who are not re-enrolling or who have not heard that they have to re-enroll in insurance, which means if they don't enroll by the 15th of December, that they won't have coverage for their health care needs. So they may be showing up in the emergency rooms, they may be coming in when whatever their condition is exacerbated because they haven't taken care of it in a timely fashion. So we are seeing at this point in time a large number of uninsured patients. Already it's about 30% of the patients that come into Primary One Health that are uninsured, including homeless. So that's a part of our total population that we're seeing. The Medicaid has covered some of the other patients. About 48% of the other patients walking in our door are covered by Medicaid, and about 10% by Medicare, and then about 10% by private insurance. But there's still that 30% that is uninsured. Some can pay a little, some pay nothing. And so that's what the partnership with the city and then the grant dollars that we receive from the Health Resources and Services Administration, that's the money that's in peril right now. That $6 million that we were receiving, right now it is in limbo. If Congress does not do something by the end of this fiscal year, all of the health centers in Franklin County, all of them throughout the state of Ohio, throughout the nation, are going to face a 70% cut in their federal funding. So that is going to impact who we can serve and how many we can serve. We're fortunate that we were able to pool together resources from the federal, state, and local communities, and then with the expansion of Medicaid, that we were able to ensure or cover more people and see more people in Franklin County.
Thank you, and certainly with the CHIP program, that will also increase your numbers, and people will not have insurance for
Absolutely, because virtually, Madam Chair, virtually every child is covered with some form of insurance. But if CHIP isn't reauthorized, those children won't be covered. So they still need health care, but they won't be covered. And I just want to give an enrollment information. We have until December the 15th. And folks can come to our West Broad location at 2300 West Broad Street on tomorrow from 12 until 6 p.m. to enroll in the open market exchange, or they can call 614-526-3260 to schedule an appointment to see one of our certified application counselors. We're trying to get the word out since 90% of the marketing and communications budget was cut for the open enrollment marketing.
All right, thank you, Senator Tavares, for coming down and giving us an update on Primary One Health and the need to restore funding to the 2017 level.
Thank you.
All right, our next speaker is Mr. Ernest Perry, President CEO of Hands On Central Ohio. After Mr. Perry is Michael Corey from the Human Service Chamber of Franklin County. And then from Godman Gill, we have, Kat Cochran Yamaguchi, and then Homeport. The floor is yours. Mr. Perry.
Good afternoon, Council President Pro Tem Tyson and Councilman Stinziano. I'm here today to stand in support of the $192,659 proposed in the 2018 budget under Human Services. This funding is a cornerstone of the long-standing partnership that Hands on Central Ohio has enjoyed with the City of Columbus. Through our partnership, we are able to provide a single point of access to Columbus's health and human service system. We provide residents with a simple 3-digit extension to dial 211. 211 is recognized in Columbus and similar communities across the country as a critical first link to programs and service interventions targeting basic needs and social determinants of health. Human Service funding supports our effort to maintain this 211 system in Columbus as a free system for all residents. I'd like to share a story about a resident named Aisha to illustrate the value of this system. Aisha's life has been a journey. She immigrated to the United States with her husband in search of a better life. They thought their troubles were over when they arrived, but life proved difficult in their new home as well. Shortly after arriving in Columbus, Aisha and her husband found out they were having twins. When the babies were born, they were very sick and needed a lot of medical care. Her family didn't have a car, and they used hands-on 211 service to find transportation. They thought things would then get easier with transportation taken care of. Aisha and her family lived near the rear of a trailer park, and while she felt safe, many of the taxi companies would not pick her up. Some of them even wanted her to walk to the front through the snow and ice with her newborn children. She called 211 again to let them know about her challenges, and Hands On was able to find a cab company that was willing to pick up Aisha. Now she and her family always ride the same taxi. The company even took her to the one store she could find that carried a special baby formula she needed because of her baby's health condition. 211 helped her find that store as well. Every day, hundreds of families like Aisha's depend on 211 for transportation, food, and the health and well-being of their newborn children. The Human Services funds in the budget make this possible through valuable partnerships with organizations like Hands on Central Ohio. You can reach us by dialing 211 24 hours a day or by going to our website at 211centralohio.org. Thank you.
Thank you, Mr. Perry, for coming down and certainly just giving us an illustration of the work that you do each and every day. And thankful that we have the funds are in the budget to be able to support you and this partnership that you have with the city to make sure that, again, our vulnerable residents get the services they need to enhance their quality of life. Thank you so very much for your leadership.
Thank you for your support.
Thank you. Good evening, Mr. Corley.
Good evening, President Pro Tem Tyson and Councilmember Stinziano, wherever he may be at the moment. Be right back in. It is my great and humbling pleasure to address you this afternoon and to offer my gratitude for the financial support you provide to human services in Franklin County. My name is Michael Corey, and for the past 7 months, I have had the privilege of serving as Executive Director of the Human Service Chamber of Franklin County. We represent nearly 60 nonprofit organizations in our community, each of which is providing a critical service to vulnerable populations in this critical time. Our job at the Chamber is to be their champion, to pursue the resources they need, and to bring them together with partners in philanthropy, in business, and in government, all in building toward a vision for our community that we all share. That vision is not yet a reality, of course, but each of our organizations is committed to making this community better. So too is the Human Service Chamber. Our membership is diverse in every sense of the word, in size and scope, in communities and neighborhoods served, and in challenges faced. Our organizations work extremely hard to provide support and opportunity through services in several areas: housing, health care, behavioral health, refugee and immigration services, child care, education, workforce development, reentry services, alleviating food insecurity, care for seniors, homelessness, and more. Despite their differences, our membership also has much in common. There is an urgency to the work that each organization does, not just amongst the leadership and staff at each nonprofit, but amongst the people in need of the services they provide. At a time when needs are escalating, whether in combating infant mortality, combating the addiction crisis, and providing affordable housing or health care, in ensuring supportive services for our refugee and immigrant populations, or in delivering nutritious meals for children, for seniors, and everyone in between, the human service organizations in our community are as important as ever. So too is the financial support they receive from Columbus City Council. Of the many recipients of your support, the vast majority are Human Service Chamber members, and I feel comfortable in speaking on behalf of all the recipients in offering my sincerest gratitude for your commitment to them and to their work. Every single penny our nonprofits have is critical and allocated scrupulously to maximize impact. And I know that you have seen that impact firsthand, having visited with several of our organizations, attended their events, or read their publications. I have seen that impact as well. In visiting with our member CEOs over the past year, in touring their facilities and learning of their challenges, it is difficult to overstate the value each of our members provides to this community. And the financial support you provide makes that work possible, both for our members and for the Human Service Chamber. But there is also trust being built between each nonprofit staff member and the people they serve and that you're serving too. One of our member CEOs shared a story with me that I feel compelled to share. A man came to them recently, eager to work, and without the ability to speak much English. This CEO and her team worked diligently to prepare him for employment, to teach him the English language, and to get him a job. He is thriving now and comes back to visit them often just to say thank you, both in his native tongue and his new one. His picture sits above the desk of one of the caseworkers that helped him find his way, which to me is the perfect illustration of how much our organizations care about this work. As my friends at the Columbus Foundation say, this is not only hard work, it is heart work. For our member organizations, that heart work is helping our struggling neighbors land softly in difficult times. It is helping people rise to their feet and helping them move forward once again. It is work our agencies are honored to do, and we at the Human Service Chamber are honored for your support.
Mr. Corey, thank you for certainly sharing so eloquently what the social service and human service agencies do, again, to enhance the quality of life of individuals in our community. I also want to say congratulations and thank you to you for your leadership for the Human Service Chamber. Just appreciate the opportunity to work with you and the members of your organization, and look forward to the continued partnership with the organization as well as those agencies that we are supporting, and again, even the agencies that we may not be supporting, but appreciate the partnership and what they do in our community. Thank you so much.
Thank you.
So Godman Gill, Homeport, Boys and Girls Club, Gladden, and then Ms. Fennell.
Thank you, President Pro Tem Tyson. I'm excited to share the impact of our Pathways to Work Transitional Jobs Program made possible by the funding from the City of Columbus. Kat Cochran Yamaguchi, Program Officer of Workforce Development for Godman Guild. This experimental job training program is unique in the Columbus community. It's filling a service gap by giving the hardest to employ job seekers a chance to earn an income in an intensively supported environment. So here's a picture of who we serve. On a given orientation day, we might have 10 individuals who walk in. All 10 have been unsuccessful in the past month in securing employment on their own. 6 are single mothers facing significant child care access barriers. 7 are dealing with criminal background records and issues. 4 are homeless or in precarious, insecure housing situations, usually in rooms or on couches of family members. And 4 are in recovery from addiction and substance abuse histories. We meet these citizens where they are in their employment readiness. They have the chance to learn job skills in in-demand work fields, such as healthcare, early child care education, food service, warehouse work, environmental, and custodial services. To illustrate this, I will share Jeff's story. Jeff came to us this past program year. He suffered from addiction for several years and had been in recovery for 1 year when he was referred to us by the Church for All People. Prior to that, he had been searching for employment on his own for several months with no luck due to his lack of employment history and his criminal background record. that was developed during his years of living in active addiction. He enrolled in Pathways to Work. He was placed on the Mid-Ohio Food Bank Roots Cafe work crew. With the support of his job coach, helping him learn the different roles and responsibilities in that work environment, he excelled quickly. He got the chance to try out lots of different skill sets, working the cashier, working in the marketplace, working in food prep, and as a dishwasher. Because of his success in this, we were able to work with Nationwide Children's Hospital to advocate for them to consider him joining their work crew at just a little bit of a higher standard of background check. And again, he excelled at all of the roles he was placed in at Nationwide Children's Hospital. And 30 days after working there, he was offered a permanent full-time position in the Nutrition Services Department. So Jeff is very grateful for his experience in the Pathways to Work program. His awesome attitude, his extraordinary work habit, helped to support his sobriety, helped him to maintain this employment with the support of his job coach and the program social worker. He's really grateful for his experience and the chance to start over on a new career path, which is really what we're all about. So here are some successes. This year we helped over 160 City of Columbus residents who were unemployed to get the opportunity to work on a transitional jobs crew and earn a wage. Over 97 of these individuals have successfully gained permanent employment positions. Of those 97, 53, or about 55%, have surpassed 90 days at their place of permanent employment. Others are a little earlier on in their placement period, so they're still getting tracked and getting supportive services to reach that point. In addition to the City of Columbus, our financial partners include Franklin County Department of Job and Family Services, PNC Bank, and United Way. Our employer partners include Mid-Ohio Food Bank Roots Cafe, Donato's, Connected Pathways Early Learning Center, Peace Love Bling, Ohio Health, and Nationwide Children's Hospital. We are continuing to explore new partnerships. Most recently, we started the planning process with AEP to help connect folks into line mechanic positions that are open, which have really great starting wages and very quickly, within a few years, double wages. For more information, folks can go to godmanguild.org or call the Guild, ask for me, ask for Trasia, and we will help connect them into the Pathways to Work program. We want to thank you for your time and attention and your support for this initiative.
Thank you, Kat, for coming down and certainly sharing the success of our transitional workforce program. Certainly it has been a success. Just appreciate the work of the job coach. It's so important for individuals who have not been in the workplace. And just thank you and Ellen for the work that you're doing to enhance people's lives.
Well, thank you.
Thank you.
Appreciate your support.
Oh, thank you. Our next speaker is from Homeport, Maud Hill. I'm not Maud Bell, right? Homeport. And I'm like, okay, I'm sorry. And then Boys and Girls Club. I guess Rebecca, you're going to be coming up to, okay. And Gladden Community House, I saw Joy. And then Alicia for now. I'm so sorry. I saw her sitting there. I said, maybe she didn't hear me say Homeport, but no, okay.
Good evening, President Pro Tem Tyson. My name is Alex Ramsib, Director of Resident Services at Homeport. Here to speak a little bit about the supportive services that we offer to the residents living in our housing. As you know, Homeport is home to more than 5,600 low and moderate income individuals in Central Ohio. This includes both families and seniors. In the understanding that providing a roof over someone's head is only the start of a stronger home, Homeport surrounds its rental communities with comprehensive supports to promote long-term stability and health. This important work would not be possible without support from the City of Columbus, so thanks to you, Homeport's Resident Services Department accomplished the following in 2017. We joined the United Way's Care Coordination Network, which has improved the overall quality of services that our residents received, connected more than 250 residents to nearly 600 social services, including educational programs for adults and youth, emergency financial assistance, financial counseling, furniture, parenting resources, and food assistance. We stopped 64 families from being evicted by linking them to nearly $92,000 in emergency rent and utility assistance. This was done in collaboration with the Columbus Foundation, whom we partnered with since 2014 to stop a total of 181 evictions, leveraging more than $280,000 in emergency rent assistance. We've conducted an intensive analysis of our eviction prevention and financial capabilities programs, which included gathering feedback from more than 100 residents to improve the quality of the programs we provide them. created 183 individualized care plans for our seniors in collaboration with National Church Residences, which will allow them to live independently for as long as possible, served 180 youth through 7 after-school and summer camp programs through our partners, which include the Boys and Girls Clubs of Columbus, Ethiopian Tewahedo Social Services, and Columbus Area Integrated Health Services. Provided 115 new Americans with culturally sensitive case management services, provided nearly 15,000 meals to youth participating in Homeport programs in partnership with Columbus Recreation and Parks Department and Children's Hunger Alliance. And we sent a team of resident leaders to the NeighborWorks America 2017 Community Leadership Institute in Los Angeles, California, which resulted in the creation of resident-led community action plans, which we plan to implement in our communities in 2018. Thank you for your continued support of Homeport Resident Services.
Alex, thank you, and certainly thank you for coming and sharing the amazing work of Homeport. I was just feverishly writing down these notes, and I from working with families, with infants to seniors, just the whole spectrum of a person's life. Thank you for serving them. I'm very appreciative of the work that you're doing around making sure that individuals are not being evicted. That's so important to our community, and providing them the resources they need to be stabilized. So I appreciate that work. I appreciate the work with our young people because they are the future, and providing the supportive services to 5,600 people. So thank you for the work. Thank you, Ma. Thank you, the whole team, and just for the work that you're doing in our community. Happy to support you.
Thank you.
Thank you.
Good evening, President Pro Tem Tyson and council staff. Thank you for giving me the opportunity to be here tonight. Boys and Girls Clubs receives funding both from Human Services funding and also this year with some workforce development funds. And it has helped us in 2017 serve 6,000 young people between the ages of 5 and 18. What I want to do tonight is highlight one particular program, youth employment programs, which was new to us this year and the result of some kind of tweaks in how the program was administered. Throughout the year, Boys and Girls Clubs offers workforce development opportunities for youth and teens ranging from career exploration, work-based learning, summer jobs, and year-round internships. Our goal is for teens to be first job ready and have a plan for the future that includes college, a 21st century career, or military service. This year, with help from the City of Columbus, Franklin County, and private funders, we were able to offer over 280 teens with work experience and also case management services. And in addition to providing many teens with their first jobs, our youth employment efforts this summer helped many of our youth realize some important outcomes. Most notably, participants in our workforce programs this summer realized summer learning gains in school. These are CCS students, something that is rarely seen among the demographic of young people that we serve. After participating in our programs, we saw the number or the percentage of students in the alarm and warn categories in core academics go from 46% in May of 2017 all the way down to 15% in September. And when we isolated this, it was 41% to 12% in core academics. And when we isolated this for math only, we saw the number of youth in alarm and warn go from 46% in May down to 15% in September. And even more exciting was that 52% of our participants went back to school in September on track or excelling in math, and that was up from just 27% in May. So we're sending kids back to school after these engaging work experiences, better off than they were before, which is really exciting. As we move into 2018, more than 80 youth are currently being monitored by our case managers, and any change in their school or club attendance or social emotional learning indicators results in them being engaged in an individual success plan. This has prevented several teens from dropping out and has helped many others get connected to jobs and intervention services. This is currently in place at our Southside Club, but next month we will expand that to our clubs in Franklinton, Milo Grogan, Hilltop, and Wineland Park, and in 2018 it will expand even more. As we look to next summer, Boys and Girls Clubs has already secured commitments from UPS, the U.S. Army, and Attorney General Mike DeWine's office, and several other partners to work with us on teen leadership development and employment. And finally, the Boys and Girls Club was really proud to welcome several of our summer youth employees onto our team permanently as junior staff members and permanent members of our team. So one of these young people is here with us tonight, and his name is Lydell Williams. And before I introduce Lydell, I just want to thank the City of Columbus. I want to thank Mayor Ginther, the Workforce Development Board, because without their partnerships, we couldn't go on these journeys that we're going on with young people, and it really does take a village. Lydell is a really special young person, and on the way over here, he was telling me about his job with the Boys and Girls Club has really changed his life. But I think what's been great about working with young people like Lydell is it has opened our minds. I don't think he would have come to us through a traditional employment or application channel. And I think it's making us better as an organization and making us think outside the box about, the many ways that we can help young people in this community, both as clients, but also as employees and just part of the team. So Lydell's going to speak briefly about some of his experiences, but he's a great spokesperson for the young people in this community.
Good afternoon.
Good afternoon, ma'am. How you doing?
Wonderful, thank you.
That's very good to hear. My name is Lydell, and I'm actually here today to tell you guys my experience with the youth employment. And before I actually started the youth employment, I was actually a very, very troubled kid. I gave my mom a hard time, always had her worrying about me. When I started, I used to walk in like, it's another job. But, being there a while, I got real used to it and started seeing that there's more. I'm so sorry, I'm so nervous.
Take your time.
When I started, actually, let me just tell you, I used to smoke a lot. I started at the age of 15 due to peer pressure. And when I got to working with the kids, I used to look at them and think, oh, I'm being selfish. Why smoke if I could do more to help children? And from there, I love this job. All the staff treat you like family. When you go in, you feel love. The kids, they run up to you with a smile. Hey, I'm happy to see you. But overall, everything is great, changed my life. I see things in a different perspective. They actually dropped out of school, and they actually helped me get back in, and I am very thankful for that, so thank you. And yeah, that's pretty much it. So thank you, and sorry again, I'm still very nervous.
That's okay. What school do you attend?
Right now, Life Skills.
Life Skills,
Yes, ma'am.
Okay. And how are you doing in school?
Right now, I'm doing okay, but I'm very busy, but still, the Boys and Girls Club are still very much helping me.
Okay. I'm sure you're going to do very well.
Thank you. I appreciate that.
And I really do appreciate you coming down and sharing your story. I also certainly, Rebecca, I just thank you for your work at the Boys and Girls Club. It is so important, and this program is pretty exciting, this workforce development program, and just the numbers, the statistics, and thinking about what happens with the summer learning gains, and these numbers are just amazing. That's all I can say, from 41 to 12 to 46 to 15, and young people going back to school that are ready to take the exams and to excel. That it's just amazing work, but also giving them confidence because of when you see yourself succeed. So I thank you for the case management that the young people need, but also providing them with an opportunity to be able to gain skills and also to upsell and have money in their pockets to be able to spend and buy things for themselves. I'm excited about the expansion of your program for more young people to have that opportunity. So Rebecca, thank you for your work that you do each and every day for our young people. And to Mr. Williams, I thank you for coming and sharing your story. Continue to work closely with the Boys and Girls Club so that you can absolutely reach, your full God-given potential to move. And so thank you for coming down. I'm going to now, whenever I see Rebecca, I'm going to ask about you.
Thank you.
Thank
Yeah,
you.
You know, he worked at the J. Ashburn Junior Club last summer. I forgot to mention that. And we'll be back there this summer. He's going through some additional training opportunities. And not to keep going on, but I just can't say enough. You know, when I first started this job, I always thought, you know, our staff will have this one mold and our kids are a service, but we're really finding that there's ways that we can serve this entire community just in ways that we never thought was possible, and in ways that's, you know, changing our team members' lives, making them better leaders, you know, opening my mind to how we can do better for young people and do better for this community. And so, you know, thank you to the city. You provide such vital funding. You've allowed us to open doors in neighborhoods that we weren't in before. And, you know, it's just an incredible blessing, and everybody on our team is eternally grateful. So thank you. Thank you.
Mutual admiration. Thank you so much. Thank you. Who's next? Good afternoon. Good evening, Joy.
Yeah, good. Yeah, it is after evening now. So, good evening, President Pro Tem Tyson and Councilmember Stinziano. It is an honor to be here this evening with you. On behalf of Gladden Community House and the Near West Side residents, we thank the Columbus City Council for your financial support for our food pantry and our youth team sports programs. With the City of Columbus Human Service Funds, our food pantry has served 11,000 individuals and 325,000 meals a year. 150 deliveries to homebound seniors and disabled residents. And we also distribute fresh produce weekly through our food pantry. And with the City of Columbus support, we've provided low-cost, year-round, community-based team sports to our children on Columbus's west side. Our team sports program engages 550 youth and 60 community volunteer coaches, providing 18,850 hours of healthy activities. We are the primary team sports provider for the youth in our Central City community. In addition to promoting fitness and physical development, the program develops cooperative skills, leadership, and social-emotional competency in our youth, and a sense of community engagement and pride in our many adult volunteers and hundreds of participating families. With Columbus's west side having an increase in crime, it is vital to engage youth in positive activities during after-school, weekends, and summer hours. Our team sports program is an indispensable community resource. Therefore, I am asking the City Council's continued financial support of $90,000 to support our 2018 team sports program. I thank you again for supporting Gladden Community House.
Thank you, Joy, for coming down and sharing. I know that you're in the funding, the competitive funding, that you were part of the competitive funding stream to serve those 11,000 individuals through that particular program. And then I know that the other program got funding from the council this last year to support your sports-based program. And so,
yes, thank you.
And certainly, I want to thank you for coming down and sharing that you've served, 550 youth. I do understand the importance of youth being engaged, because that means that they're doing something constructive with their time. And so, as we look to the budget for 2018, would certainly take this additional year of funding into consideration.
Thank you.
Thank you. Thank you for all that you do in our community. And our final speaker tonight is Ms. Alicia Fennell. Good evening.
Alicia Fennell, Columbus Stronger Way Jobs Initiative, Westerville, Ohio. Good evening, council members and viewing audience. I have your funding solution. I'm continuing to advocate for a citywide transitional jobs program financed through a 10-year 0.5% city income tax increase, raising $120 million per year to get dedicated to a paid job training, job creation program for Columbus residents. This annual fund could create 10,000 six-month full-time paid job training positions, providing up to a minimum wage payroll reimbursement for small minority businesses, nonprofits, and municipalities, which could utilize this subsidized labor force in exchange for providing participants on the job training in a marketable skill. At minimum wage, although most positions would pay more, these jobs would provide residents a monthly survival paycheck of over $1,000, along with earned income tax refunds. Transitional jobs is a practical workforce strategy that uses time-limited, wage-paying jobs that combine real work, skill development, and supportive services to transition participants successfully into the labor market. Large Columbus disadvantaged worker populations include over 10,000 homeless, 35 ex-offenders released per year, half of our Columbus zip codes with high unemployment, and half of our youth in Franklin County are out of work. We're second in the nation for economic segregation. Joblessness contributes to taxpayer expense versus a job solution providing a job training conduit whereby residents become economically self-sufficient. I reasoned that Franklin County Commissioners in 2013 voted for a 5-year quarter-penny increase of the sales tax to build the new Franklin County Jail and morgue. This tax ends in 2019. Next, it's time to transition into a 10-year 0.5% city income tax increase, bringing in twice the annual revenue at $120 million a year, funding a jobs program. Tax increases are not voted down by the public when they make good sense. In January, my organization and other stakeholders will be commissioning a reputable polling firm to gauge public opinion from Columbus businesses and residents, all voters, to confirm that a jobs proposal would be a welcomed and much-needed proposal. If this poll proves favorable, I hope city leaders will facilitate shepherding this jobs proposal onto the ballot. Let's support transitional job solutions, providing economic opportunity to our residents while growing small businesses to reduce the staggering numbers entering our jails, homeless shelters, and drug rehab institutions. I promote more job growth and reducing the size of our jails and public safety funding. Thank you for your time.
Thank you, Ms. Fennell, and certainly your commitment to workforce development in the city of Columbus. And I look forward to hearing the results of your polling efforts and other efforts as you continue to share new ways for us to be able to support employment in our community. Okay. Thank you for coming and testifying today.
Thank you very much.
Thank you. As we have heard, the city has prioritized jobs by investing in job training, public health with programs that address the major community health concerns, and considerable efforts have been employed to ensure that our residents are served by the best social service programs. Over the next several weeks, Council will hold hearings on the Mayor's 2018 operating budget proposal. We expect to pass the budget in early February. Before we conclude this afternoon's hearing, I'd like to thank Director Amy DeLong from the Civil Service Commission, Hannah Jones, Deputy Director of Community Development for the Development Department, Roger Cloran, Assistant Health Commissioner for Columbus Public Health. I also want to thank our non-agenda speakers who partner with us, offering valuable programs and services to our residents. So we heard from speakers from the Community Shelter Board, Primary One, Health, Hands on Central Ohio, the Human Service Chamber of Franklin County, Gottman Guild, Homeport, and the Boys and Girls Club. And again, Ms. Fennell. My fellow council members and their staffs who serve, I want to thank them for serving and their staffs who serve our community with pride each and every day. I want to thank City Council Legislative Research Office, especially Michael Kesters in Chambers this evening, Director of LRO, and Alexis Pennell, who staffs the Health and Human Services. I also want to thank Edward Johnson, who staffs Workforce Development, my staff, Nicole Harper and Carl Williams, also the hardworking team at CTV who make these hearings possible, and finally the residents of Columbus who make our city the best place in the country to live, work, and to raise a family. This hearing is now adjourned, and there will be another hearing starting in just probably in a few minutes. That is the economic development that Councilmember Elizabeth Brown will be chairing. Thank you.